So within this plan, we're going to make sure that dollars we spend go towards making insurance more affordable and more secure. We're going to eliminate wasteful taxpayer subsidies that currently go to insurance and pharmaceutical companies. Set a new fee on insurance companies that stand to gain a lot of money and a lot of profits as millions of Americans are able to buy insurance. And we're going to make sure that the wealthiest Americans pay their fair share on Medicare. The bottom line is our proposal is paid for. And all the new money generated in this plan goes back to small businesses and middle-class families who can't afford health insurance. It would also lower prescription drug prices for seniors, and it would help train new doctors and nurses and physician's assistants to provide care for American families. Finally, my proposal would bring down the cost of health care for millions, families, businesses, and the federal government. We have now incorporated most of the serious ideas from across the political spectrum about how to contain the rising cost of health care. Ideas that go after the waste and abuse in our system, especially in programs like Medicare. But we do this while protecting Medicare benefits and extending the financial stability of the program by nearly a decade. Our cost-cutting measures mirror most of the proposals in the current Senate bill, which reduces most people's premiums and brings down our deficit by up to $1 trillion over the next 2 decades. Brings down our deficit. Those aren't my numbers. Those are the savings determined by the Congressional Budget Office, which is the Washington acronym for the nonpartisan, independent referee of Congress in terms of how much stuff costs. So that's our proposal. This is where we've ended up. It's an approach that has been debated and changed, and I believe improved over the last year. It incorporates the best ideas from Democrats and Republicans, including some of the ideas that Republicans offered during the healthcare summit, like funding state grants on medical malpractice reform and curbing waste and fraud and abuse in the healthcare system. My proposal also gets rid of many of the provisions that had no place in healthcare reform, provisions that were more about winning individual votes in Congress than improving healthcare for all Americans. Now, despite all that we agree on and all the Republican ideas we've incorporated, many, probably most Republicans in Congress, just have a fundamental disagreement over whether we should have more or less oversight of insurance companies. And if they truly believe that less regulation would lead to higher quality, more affordable health insurance, then they should vote against the proposal I've put forward. Now, some also believe that we should, instead of doing what I'm proposing, pursue a piecemeal approach to health insurance reform, where we tinker around the edges of this challenge for the next few years. Even those who acknowledge the problem of the uninsured say, we just can't afford to help them right now, which is why the Republican proposal only covers 3 million uninsured Americans, while we cover over 31 million. The problem with that approach is that unless everyone has access to affordable coverage, you can't prevent insurance companies from denying coverage based on pre-existing conditions. You can't limit the amount families are forced to pay out of their own pockets. The insurance reforms rest on everybody having access to coverage. And you also don't do anything about the fact that taxpayers currently end up subsidizing the uninsured when they're forced to go to the emergency room for care, to the tune of about $1,000 per family. You can't get those savings if those people are still going to the emergency room. So the fact is, health reform only works if you take care of all of these problems at once. Now, both during and after last week's summit, Republicans in Congress insisted that the only acceptable course on health care reform is to start over. But given these honest and substantial differences between the parties about the need to regulate the insurance industry and the need to help millions of middle-class families get insurance, I don't see how another year of negotiations would help. Moreover, the insurance companies aren't starting over. They're continuing to raise premiums and deny coverage as we speak. For us to start over now could simply lead to delay that could last for another decade or even more. The American people and the U.S. economy just can't wait that long. So, no matter which approach you favor, I believe the United States Congress owes the American people a final vote on health care reform. We have debated this issue thoroughly. Not just for the past year, but for decades. Reform has already passed the House with a majority. It has already passed the Senate with a supermajority of 60 votes. And now it deserves the same kind of up or down vote that was cast on welfare reform, that was cast on the Children's Health Insurance Program, that was used for COBRA health coverage for the unemployed, and, by the way, for both Bush tax cuts, all of which had to pass Congress with nothing more than a simple majority. I have therefore asked leaders in both houses of Congress to finish their work and schedule a vote in the next few weeks. From now until then, I will do everything in my power to make the case for reform. And I urge every American who wants this reform to make their voice heard as well. Every family, every business, every patient, every doctor, every nurse, every physician's assistant. Make your voice heard. This has been a long and wrenching debate. It has stoked great passions among the American people and their representatives. And that's because health care is a difficult issue. It is a complicated issue. If it was easy, it would have been solved long ago. As all of you know from experience, health care can literally be an issue of life or death. And as a result, it easily lends itself to demagoguery and political gamesmanship and misrepresentation and misunderstanding. But that's not an excuse for those of us who were sent here to lead. That's not an excuse for us to walk away. We can't just give up because the politics are hard. I know there's been a fascination bordering on obsession in this media town